Hi, my name is Claudia. I'll be performing a newborn assessment on your baby. I'm just going to come in, perform hand hygiene. Mom, can I see your wristband? I'm going to match it to the baby's wristband. Okay, let me just provide privacy. First thing I'm going to do is just check for safety. So I noticed there's not a bell in the baby's crib. I'll go ahead and I'll put a bell in. That'll be the only thing in the crib other than the baby. And then if I'm checking for AGPAR, at this time I'll check for appearance, pulse, grimace, activity, and respiratory effort. That's going to be done within the first minute of the baby's birth and then 5 minutes later. So first, after I perform hand hygiene, I'm going to assess the baby's corneal and sagittal sutures. So I'm just going to check the head. Fontanelle is flat, no abnormalities. Now I'm going to check eyes. So I'm just going to use the pen light and see if baby opens eyes and that they're reactive. Okay, good. No redness or discharge noted. Now I'm going to check for baby's ears. Just going to make sure that the top of the ears align with the lower canthus of the eyes. Check both eyes. Check both ears. Good. So no redness, no drainage. I'll check nose. I'm just going to check patency. I'll include each nostril, just to make sure the baby can breathe through both. Okay, perfect. So bilaterally patent. I would suction as needed, and I can actually, let me try this again. I'll listen with the stethoscope. Good. So bilaterally patent. Now I'm gonna check mouth. I'm just gonna assess to see if there's a cleft palate, and I'll do that by sticking my finger in baby's mouth and feeling around the roof of the mouth. Okay, I'll assess for the sucking reflex and I'll assess for the rooting reflex. So I'll go ahead and run my finger across baby's cheek, and so baby should turn his head towards my touch. Okay, at this time I'm gonna check the neck. Just gonna assess for any webbing. I'll assess toes and fingers. Make sure there's no webbing. Okay. Arms are even. Feet, legs are even. No webbing. Okay. Baby's arms are flexed, which indicates good muscle tone. We'll do palmar grasp. So baby should hold onto my finger. And then I'll go ahead and I'll do good. Baby's toes fan out. Okay, baby's not cold. If the baby was cold, I would encourage skin to skin. All right, Mom, I'm going to go ahead and we can go ahead and perform a skin to skin touch so I can assess the baby's bottom and the baby's spine. So hypothetically, I'll go ahead. Oh, and then for the toes, it was plantar grasp. And the toes would curl, not extend. Okay, so go ahead and I'll just assess the spine curvature. I would assess for Mongolian spots and educate that if there were spots, they aren't bruises, even though they might look like bruises. And I will go ahead and I'll assess for sacral dimples, which can be indicative of spina bifida. Okay, perfect. All right, Mom, go ahead. Bring baby back to the crib. I'll go ahead and auscultate baby's heart. We have the femoral pulse and the brachial pulse. Okay, I would use the bell side of my stethoscope, and I'll listen for heart for a full minute. Same thing, I'm just going to go ahead and listen to the heart fields. And then at this point, I'll go ahead and I'll count baby's heartbeat for the full minute. Normal range should be between 110 and 160 beats per minute. Okay, perfect. Now I'm going to go ahead and listen to baby's lungs. So same thing as if I was checking adults. Listen to the lung fields. And the normal range for a baby's respiration should be between 30 and 60 breaths per minute. I'll also listen to the full minute because baby's breathing is irregular. Okay, now I'm going to go ahead and listen to bowel sounds, just to ensure that baby's bowel sounds are active in all quadrants within the first 15 minutes of birth. Okay, normal, active. I'm going to measure head and chest circumference with a measuring tape. So that measuring tape, go ahead and then I'll measure. Okay, good. And then I'll go ahead and I'll measure circumference with a measuring tape. Centimeters, good. And then just be careful when I remove it. Okay, at this time, we're just going to assess genitalia. So I'm just going to check the diaper. Okay, this is a male. Rhythm is at the tip. Everything seems normal. I'll go ahead and I'll assess the umbilical cord. And when I put the diaper on, just make sure that I don't touch the umbilical cord or get too close to it. I'll assess for redness, swelling, drainage, or bleeding to the umbilical cord. And then I will educate the mom that it will dry out on its own within about 10 to 14 days. Don't cover it. Don't cover it. Don't put anything on it. Just let it be exposed to air. Okay, now I'll go ahead and I'll take the temperature. I have the temperature probe, and I'll go ahead and I'll stick it in upwards like that, just to make sure that the tip of the probe is on the axillary site. Check temperature. Okay, temperature is normal. This is the part where I just educate the parents that there should be no stuffed animals or loose additional blankets in the crib. And then, like I said in the beginning, we'll keep the bulb syringe at the crib side. That really should be the only thing that's in the crib. Okay, Mom, do you have any questions? If there are no questions, I can go ahead and I can remove my gloves, perform hand hygiene, clean my equipment, and then I will go.